Gentlewoman kneels back. Dr. Miller-Meeks, you're recognized for 7 minutes.
Thank you very much, Chairman Bost, Ranking Member Takano. Thank you very much, Secretary Collins, for being here. And as both a veteran and a physician, thank you for your advocacy and support of our veterans. Let me also just start off before my question, echoing Ms. Brownlee's last statement about the team-based model in anesthesia care. As both a nurse and a physician, married to a nurse and a veteran, I would echo that sentiment that we want to deliver the best care to our veterans. The committee has heard about reports of a referral coordination initiative being used as a means to bring back care into the VA once a veteran has been referred to community care. And I'm also going to say that I was a proud veteran delivering community care within a community for veterans. So I've been part of that process on the delivering end of community care. And you made a statement that community care is VA care. So my presumption would be that it should be left to the veteran to make that determination, whether if they've had initial community care, if they want to transfer back. Could you give me your thoughts on that?
Yeah, that is exactly right. I think this is a choice that we need to give to the veteran because it's in law, and this is the way the law is interpreted. You meet the qualifications, you get the choice of community care. And I think that's one of the things that we've seen, though, unfortunately, in the last few years is, and this is a story I'll tell, and it's because it's very concerning to me, because unfortunately for some, the Mission Act and some internally in the VA seem to view the Mission Act as setting up an us against them scenario, the VA care versus community care, that the doctor's here and the doctor's there. In fact, it was unfortunate this past week, I was asked a question when I was traveling in Minnesota, in which somebody who was not happy with me, and that's normal, but we get it. They actually said to the reporter, and the reporter asked me the question, well, why would we need to keep all veterans in VA? VA has the quality care and the community doesn't. And I thought to myself, why would somebody who is protesting us degenerate all the doctors in Minnesota? Because that's exactly what they did. Whether they meant to or not was irrelevant. That's what they did. We've got to get over this idea that it's one doctor against another. There's also a thought inside the VA that the VA doctors in some way are supervising the community care doctors, and this is slowing some of our work down. The other issue with community care that is problematic, and I hope we get to talk about this today, is our electronic health records management system, which does not allow us to communicate with doctors. So for us, it's just about getting the care to where again, veteran first. Not VA first, veteran first. The VA is there to exist to serve the veteran.
Thank you. This Fox grant program is set to expire at the end of this fiscal year. What do you see as the long-term role of this program in VA suicide prevention strategy?
I think it's a great program because it actually brings in some different voices into the conversation, but I'm not satisfied at all with where we are in our response to our veteran suicide issue, our death by suicide issue. This is just not something that's tolerable. To the folks on this committee, and especially if you're new to this committee, just understand since 2008, our veteran suicide number has not changed. Understand, 2008, our veteran suicide number has not changed. But yet over the past few years, we have added $588 million every year for the last few years to suicide prevention. It's not working. So I want to use grants and programs like this to reach out beyond the scope of where we're currently reaching to say, how can we actually touch the veteran that's not being touched right now by these programs? Here's another thing for you. Out of that, whether you use 17 is your number, 22 is your number, whatever number you have, half of those have never had VA connection. Half of them we've never had a chance to touch. So we've got to do better at using the grants, using our programs to go outside the normal bubble and use others to help get the word out.
You may not hear this question. I agree with that, and also General Bergman's comments about emerging breakthrough therapy. Never thought in my medical career I would be talking about that, but yet it does show promise in reducing PTSD and suicide. The VA's leasing process continues to face long delays, overruns, and cost overruns with outpatient clinic leases, and the building for those leases, the construction, often taking years to complete. Do you have a plan for that? And if not, I would love to meet with you. I've met with people within my district who actually do construction. They're more than happy to save the VA money at their behest, making less money for them in order to have a more efficient process.
Congresswoman, this is going to be the one time I'm looking at the ranking member and the chairman, and I just as I did this morning with the Appropriations Committee and everybody in this committee, help me. Our procurement system, especially when it comes to construction and new facilities, is broken. I mean, and we're not even at the point where, and this is not throwing anybody under the bus. It's just they're given a system that doesn't work. And I was here, and several of you were here when we had the issue first come up, and we started. One was in Colorado, then there was others that were. Right now, it's no reason, in all fairness, that it takes $1.6 billion to build a medical center. There's positions on this panel. Your local hospitals, in fact, in my hometown, just built a 100+, several hundred patient bed system. Put an OR in it, put an ER in it. They built it in less than 2 years, and it's a lot less cost. Our leasing programs need to be streamlined. Our building programs need to be streamlined, because right now there is not really, if you would, as I call it, that touch point, that one belly button touch point where I can actually say, you're responsible for this, or holding them accountable for contracts in which they don't meet their deadlines. So I'm asking for help here on this one.
Be happy to help you with that in our Chip In Act. And then this is just a very, very minor thing, and I know it's minor, but I've had veterans in my district contact me and send me photographs of our VA hospital which show a blank wall, and the photographs of the president and the vice president are not there. I know it's a minor issue. Is this something that comes from the VA, or how can I help these veterans and answer their problems? So if you could just address that quickly. And I know you gave me extra time, so.
No, I appreciate it. No, they should have the pictures. There was a delay, and I think one of them was that the vice president's picture was one of the delays. My picture, look, it's out there in the president's picture. It's very important to our veterans. I get those calls all the time. We're doing everything we can to get those pictures out and make sure. And this is a change to any administration. It needs to happen quicker. It doesn't most of the time. But I think it's being done as quickly as possible.
Thank you so much. I yield back.